Welcome back to Sleep Better TV with my guest, Dr. Blake Perkins of Dental Sleep Medicine of Vancouver, Washington, as we continue our discussion on the treatment of sleep breathing disorders. Dr. Perkins, welcome back. How did you start treating obstructive sleep apnea as a dentist?
Actually, I happened to have a patient of mine who came in asking about ways to treat sleep apnea that were different than the CPAP machine that she was currently using. And at the same time, I found out an employee of mine, my office manager's husband, had sleep apnea. And I became intrigued about ways that we as dentists could address this condition and help people without having to use the CPAP machine if they didn't have to.
So for dentists, what kind of training do you go through?
Well, that's interesting you ask, because in dental school there really is little to no education on how to treat sleep apnea as a dentist. I was in school, graduated in the year 2000, and back then we had absolutely no training at all. So all the training and knowledge I've had to gain has been on my own through continuing education courses and conferences, so that I could know what I know today. Thankfully, some schools today are starting to integrate that a little bit into their curriculum, but to really know what you're doing in treating sleep apnea, you've got to spend some quality time outside of your practice.
So I'm guessing that a lot of people don't know that dentists actually treat this problem. How does a patient know if, they've got the right dentist?
Well, I would probably ask a few very important questions if I was told I could go to a dentist to have my sleep apnea taken care of. The first thing I would ask is, how many times have you done this? How many appliances have you made? The second question I would ask is, obviously, how successful are you in treating sleep apnea? And probably the third and most important question is, what do your patients say about their results?
Now finally, is it possible to start with the appliance and completely skip CPAP?
No, it's very possible for somebody to start right away with the appliance, which is why it's very important to get the proper diagnosis from the start. If someone is diagnosed with mild to moderate sleep apnea, we know from studies and experience that it's very successful treating sleep apnea with a mandibular advancement device. With severe sleep apnea, we advocate very strongly to use a CPAP machine first, and if that's something that's not tolerated, then we have to help them find some alternative, which in a lot of instances is the dental appliance. And the only difference is we don't always get the same benefit that we would have gotten from a CPAP machine, but with somebody who is intolerant to the CPAP machine and isn't using it at all, any improvement is better than none at all.
Dr. Perkins, it has been a pleasure. Thank you again.
You're welcome.
My guest has been Dr. Blake Perkins with Dental Sleep Medicine of Vancouver, Washington, and you're watching Sleep Better TV.